Hello, dear seniors. Every 40 seconds, someone in the world experiences a stroke. Yet most of these tragedies begin quietly, with small warning signs that often go unnoticed. For people over 60, this isn't just a statistic. It's a reality that demands attention and awareness. Doctors often say that the difference between recovery and disability can come down to a single minute of early recognition. Imagine losing your ability to speak, move, or even smile simply because a subtle symptom was missed. That's why learning these 40-second checks can be life-saving. They're not complicated medical tests. They're quick, gentle habits that protect your brain, your independence, and your future. So, number 1 is about the pulse check. Your wrist can warn you. Taking 40 seconds each day to feel your pulse at your wrist or neck can quietly reveal what's happening inside your heart. Doctors often remind older adults that an irregular or unusually fast heartbeat, even if it comes and goes, may be a sign of atrial fibrillation, a common yet silent rhythm disorder. Studies show that people with untreated atrial fibrillation are up to 5 times more likely to experience a stroke because the uneven heartbeat allows blood to pool and form clots that can travel to the brain. What makes this check so valuable is its simplicity. By gently placing 2 fingers on your wrist, below the thumb or on the side of your neck, you can sense whether your pulse feels steady or jumpy. If it skips, flutters, or feels out of rhythm, it's important not to ignore it. Some doctors recommend writing down when it happens and bringing it up during your next visit. Modern wrist monitors and smartwatches can also detect irregular rhythms, but your own fingertips can often catch what technology misses. This short daily habit doesn't replace medical testing, but it helps you become more aware of your body's signals. Many strokes happen without warning, yet your pulse can whisper that warning long before it becomes serious. Taking half a minute to listen could save years of health and independence. Now, number 2, the face test. Smile at yourself in the mirror. Smiling in the mirror may seem simple, but it can quietly reveal one of the earliest signs of stroke risk. Doctors often advise older adults to perform this 40-second face test. Because facial muscles are directly connected to the areas of the brain most affected during a stroke. When you smile, both sides of your mouth should lift evenly. If one corner droops or feels weak, it could mean that a small part of the brain isn't getting enough blood flow. Neurologists call this a transient ischemic attack, or TIA, a mini-stroke that often lasts only a few minutes but serves as a serious warning. Studies show that nearly 1 in 3 people who experience a TIA will have a full stroke within the following year if no action is taken. That's why experts urge not to dismiss even a brief facial change. Some doctors recommend doing this mirror check daily or whenever you feel tired, dizzy, or off balance. It takes less than a minute, but it can make all the difference in catching early nerve or blood flow problems before permanent damage occurs. A simple smile, something we do every day, can become one of the most powerful tools for protecting your brain and preventing future disability. Now, number 3. The arm raise, the 10-second strength check. Raising both arms and holding them steady for 10 seconds is one of the simplest ways to detect early signs of stroke-related weakness. Doctors often use this quick test in hospitals because the arms reveal subtle changes in nerve function before other symptoms appear. When both arms are lifted to shoulder height, they should stay balanced and strong. If one begins to drift downward, feels heavy, or tingles, it could mean that part of the brain controlling movement is not receiving enough oxygen or blood flow. Neurologists explain that this can happen even during a mini-stroke, when the blockage clears before lasting damage occurs. Research from major stroke centers shows that people who experience sudden one-sided weakness often ignore it, assuming it's due to fatigue or poor circulation, but those early moments are critical for intervention. Performing this 10-second check once a day or whenever you feel off balance helps you recognize these changes quickly. If one arm doesn't move normally, experts recommend noting the time and seeking medical evaluation right away. This brief test, often overlooked, provides a fast and reliable window into your brain's health. helping you act before weakness turns into something far more serious. Now, number 4. Repeating a simple sentence such as "today's a bright sunny day" can quickly reveal early warning signs of a stroke. Doctors often use this brief speech test because the brainless language centers are highly sensitive to changes in blood flow. If speech suddenly becomes slurred, jumbled, or difficult to form, it can mean that oxygen is not reaching the part of the brain that controls communication. Neurologists warn that even if this problem lasts only a few seconds and then disappears, it should never be ignored. Research from stroke foundations shows that many people who experience a temporary speech disturbance are experiencing a transient ischemic attack, or TIA, which can precede a full stroke within days. Some experts suggest practicing this test daily, or performing it whenever your mouth feels numb or heavy. If your words sound unclear, uneven, or forced, it's important to note the exact time and seek immediate medical attention. Early recognition of speech changes allows doctors to restore proper blood flow before permanent damage occurs. This 40-second habit is small but powerful. It helps protect not only your ability to speak, but also your independence and quality of life. Now, number 5. The vision glance, blink, and check the blur. Closing one eye at a time and focusing on a familiar object is a quick way to detect vision changes that may point to early stroke risk. Eye specialists often remind older adults that sudden blurriness, dimness, or double vision in one eye can signal a temporary blockage in the blood vessels supplying the retina or brain. This condition, known as amaurosis fugax, can last only a few seconds, but experts consider it one of the earliest warnings of a possible stroke. According to stroke research centers, these brief vision losses are often caused by tiny clots that travel from the neck or heart to the eye's artery. If ignored, a larger blockage can follow, leading to permanent vision loss or a major stroke. Some doctors recommend doing this vision glance daily, simply covering one eye, then the other, and checking whether the image looks equally sharp and bright. If one side appears dimmer, hazy, or feels different, it's important to seek medical care right away. This short test helps you notice small but serious changes in circulation long before they become dangerous. In just a few seconds, your eyes can reveal what your heart and arteries are trying to warn you about. Now, number 6. The grip strength squeeze. Your hands never lie. Squeezing a small ball or clasping your own hands together for 5 to 10 seconds can reveal surprising clues about your circulation and nervous system health. Doctors often use grip strength as a simple but powerful measure of how well the body's muscles, nerves, and blood vessels are working together. Research from major health institutes shows that reduced grip strength, especially when it differs between hands, can be linked to higher risks of stroke, heart disease, and even mobility decline in older adults. When one hand feels noticeably weaker or slower to respond, it may indicate reduced blood flow or nerve signal disruption, both of which can occur in the early stages of vascular problems. Some doctors suggest keeping a soft ball or small stress device nearby to test this regularly. If the squeeze feels weaker than usual, or if one hand fatigues faster, it's worth noting and mentioning during your next medical visit. This small act not only helps monitor muscle coordination, but also keeps you aware of changes that often go unnoticed. The hands are excellent indicators of what's happening inside the body, and paying attention to their strength can help prevent far more serious issues down the road. Number 7. The neck check. Your arteries might be talking. Placing your fingers gently on the side of your neck, just below the jawline, allows you to feel the pulse of your carotid artery, one of the main blood vessels carrying oxygen to your brain. Doctors often recommend this simple neck check because changes in the way that pulse feels can reveal early signs of carotid artery narrowing, a condition responsible for many preventable strokes. When plaque builds up along these arteries, it can cause vibrations, uneven pulsing, or tenderness that may be felt even with light pressure. Some specialists explain that this narrowing, known as carotid artery stenosis, often develops silently over years, without causing pain or obvious symptoms. Yet when blood flow becomes restricted, small clots can form and travel upward, cutting off oxygen to brain tissue. Performing this quick check once in a while helps you become aware of anything unusual. But it's not a replacement for medical testing. If the pulse feels irregular, pounding, or accompanied by neck discomfort, doctors can confirm the cause easily through a painless ultrasound. Early detection of carotid issues allows treatment before a blockage forms, protecting not just brain health, but also balance, coordination, and clear thinking, all essential to maintaining independence later in life. Now, number 8. The breath hold, 40 seconds of truth. Taking a deep breath and holding it for as long as it feels comfortable is a simple way to gauge how efficiently your heart and lungs are working together. Doctors often point out that if you experience shortness of breath, chest tightness, or dizziness during this brief check, it may indicate that your body isn't getting enough oxygen. This can happen when blood pressure is poorly controlled or when lung function declines with age or inactivity. Research from cardiovascular studies shows that breathing difficulties are often linked to reduced oxygen flow, which can strain the heart and increase the risk of both stroke and heart disease. Some experts explain that the inability to hold a breath for even 20 seconds without discomfort could reflect underlying issues such as poor circulation or fluid buildup in the lungs. Performing this 40-second truth test regularly helps you become more aware of subtle changes in endurance or breathing capacity. If you find that your breath hold time suddenly shortens, or you feel unusual pressure in the chest, it's important to mention it to a healthcare professional. This small observation can provide an early warning about your body's oxygen balance and protect against more serious cardiovascular complications. Number 9. The blood pressure moment, numbers that save lives. Checking your blood pressure at the same time each day, whether in the morning or evening, is one of the most effective ways to protect yourself from stroke. Doctors repeatedly emphasize that high blood pressure, often called the silent killer, remains the #1 cause of strokes worldwide. Many people feel perfectly fine, even when their numbers are dangerously high, because elevated pressure density always cause pain or visible symptoms. Over time, though, the constant force of blood against artery walls weakens them, allowing clots to form or vessels to rupture inside the brain. Research shows that even small, unnoticed spikes in blood pressure can quietly damage arteries, especially in adults over 60. That's why experts recommend keeping a simple digital monitor at home and recording readings daily. Tracking patterns helps doctors adjust medications or lifestyle steps before serious harm occurs. Consistency is key. Taking readings at the same time each day gives a true picture of how your heart is performing. If numbers rise above your usual range, experts advise rechecking after a few minutes of rest rather than ignoring it. Regular monitoring transforms this simple act into a powerful habit, helping you stay aware, stay in control, and reduce one of the strongest and most preventable risks of stroke. Number 10. The sleep quality reflection, your nighttime warning signal. Ignoring loud snoring, frequent waking, or daytime tiredness can be more than just a sleep issue. It can be a warning signal from your body. Doctors often point to sleep apnea as one of the most overlooked stroke risks, especially in people over 60. This condition causes breathing to pause or become shallow repeatedly through the night, cutting off oxygen to the brain for short bursts. Studies show that these nightly drops in oxygen can quietly double the risk of stroke and heart problems over time. Many people never realize it's happening because they don't fully wake during these episodes, but they notice lingering fatigue, morning headaches, or dry mouth. Medical experts recommend discussing such symptoms with a doctor, as a simple sleep study can confirm the condition. With proper treatment, often through devices that keep airways open, both restful sleep and stroke protection can be restored naturally. So, my beloved seniors, if this video helped you understand your body's warning signs even a little better, please take a moment to like, subscribe, and share it. Someone you know might recognize a symptom just in time. Your single click could genuinely help save a life, maybe even their own.